Okay, so how do we all think it went on? Well, let me give you a bit of feedback. So starting with your assessment, the communication skills and ethics station, I think it was good. As we discussed, I think you discussed all the right issues, you addressed the patient's concerns, you addressed specific concerns about specific investigations and specific medications. You also talked about the principles, the ethical principles underpinning your approach. So yeah, that was good. And I think the assessments that we've done today with the cardiovascular sort of examination, the neurological examinations, I think they've all been good. There will be some points that we will have to learn here. Vivek, you've taken your exams recently and you're now going to be a registrar very soon. Would you like to give any advice to the candidates for the forthcoming PACES exam?
I think anything can come up in the exam, and what is important is if you have a strategy and approach to the station. So as Dr. Punica was saying, you address the patient's concern. So I wanted to focus on this. So there are marks especially for addressing patient's concern in the examinations. So what I would do and what I would advise is if you bring that right at the beginning of your consultation, whether that's station 2, which is the history, or station 4. What this often will reveal is that the patient has another agenda. So you have your own agenda as a doctor, and then the patient will have their own agenda. And then you have the whole station to address your concern as a doctor and the patient's concern. And then you can bring it up together. If you ask that too late in the station, you will not have time to address the patient's agenda. So try and bring it to the beginning. Regarding the other stations, I think the most important thing is to stay calm. The first thing when you will go into the examination room, introduce yourself as I am Dr. Guduri, rather than saying I am Vivek Guduri. This is a professional postgraduate examination, and the examiners unconsciously will have more confidence in you as a doctor when you introduce yourself like this. They will give you some instructions, and then you will be asked to examine a patient. I have a mnemonic that I use and that I've used for a long time now. It's called YCP. So W for washing your hands, I for introducing yourself, C is for consent, E is for exposure, P is for pain, and the next P is for positioning of the patient. And you should be aiming to do all that in the first 15 seconds of the exam, and you're doing it all the time, all at the same time, 15-20 seconds. And another important point would be to stand back, because we all tend to go in and start examining the patient. So stand back for about 10-15 seconds. Take a deep breath, calm yourself down, because what that will do is that will enable you to look around in the room. There might be clues. There might be clues, for example, this lady, you had a midline sternotomy scar. So there might be, it could be a patient who's had a heart transplant. Has she got a bracelet that says heart transplant on it? If you go in too quickly, you might miss that. And then those 10 seconds will enable you to also calm yourself down. You take a deep breath that will lower your heart rate, and then you zoom in on your patient.
Thank you, Vivek. Would you like to add anything from your experience?
So far with this examination and these stations that we did today, I think a good point is to make sure that I'm able to, with the examiner in my discussion, I'm able to list a few differential diagnoses, be very sure about my anatomy and be very confident about the pathophysiology, etc., so that it does come out as a confident answer and a practiced answer. And I guess this is something that you can actually guarantee some points on, rather than lose any if it does happen.
Thank you, Malika. Kareem, would you like to add any points?
Yes, speaking as somebody who has taken the exam and failed it, I must say that it's a fair exam. And you take an exam to pass it.
Yeah.
And that's the same reason people examine you, is also to pass you.
Yeah.
And it's very important to have that mindset, because as much as you may practice among your colleagues and your friends, the reality is human factors do come in on the day. One of them is anxiety and worry, and there's no replacement for good practice, and that's what's going to pass you at the end of the day. And yeah, just try not to worry. You're there to pass, and the examiners are there to pass you as well.
Thank you. Ho-Chung?
Just from my own experience during while I was doing it, I find especially when I was presenting, it would have been really helpful to do it like Kareem, where he had his hands back, because where I felt when I had my hands were forward, I was just beginning to fidget, and I was getting very conscious about my own fidgeting.
I think that's an important point, which is avoid fidgeting. Yeah, that can only add to the anxiety. Okay, so Asima, would you like to add anything from your experience today?
Well, I believe my communication skills station, I didn't find it hard. It went quite smoothly, and the reason for that is that, particularly as CMT1 on my wards, I have never tried to escape the situation where it is the matter of breaking bad news or involving in difficult discussions with patient and taking decision with indirect supervision of my consultant or registrar. That really helps. It doesn't matter whether that scenario has been given in a particular book. You can be probably presented with anything during your exam day. So the best thing is that you do exam directed study, but at the same time, because you're not going to get a lot of days off from the work, while you are at the work, try and practice with regards to, as you are going to appear in an exam. For example, lately when I'm working on AMUs, I'm trying and see my patient with regards to, okay, how I'm going to approach that case with regards to station 5. What I'm going to do, if I'm going to examine maybe a patient with a good cardiovascular sign, I'm going to examine fully, because that's my only chance and best chance, rather than coming late from home and try and examine the patient. So try and utilize as much as time we are on the wards while examining the patient. Try and get involved as much as with patient discussion as you can. That's probably something which can help.
Thank you, Asima. I think that's a great bit of advice, actually, which is, while you're on the wards, make the best of the time you have there. Laura, would you like to add something?
Yeah, I just feel as though, I'm a fifth year medical student, and I've recently just come out of your final medical student exams, and it's really interesting to see that there are so many similarities in the structure of the stations and the topics selected. Of course, the MRCP is much more difficult, and the content and the sort of medicine that you're expected to know and the level of the anatomy and physiology is much greater than at medical school. But I do think there are a lot of similarities, and I think it's important to take what you've learned from medical school and don't lose that, and take it forward to exceed in the MRCP exam.
Thank you.